Dr. Kopp, thank you for coming into the Wood Library Museum today. I pulled these things out for you to look at as part of the history of regional anesthesia. Actually, treating pain goes way back. One of the first drugs that was used for that purpose that's still somewhat used today is belladonna. That is better known today as atropine, and it's used by anesthesiologists for lots of different things. But it's no longer really used as a pain remedy. What came along really to replace that, and sometimes was combined with it, was cocaine.
Well, thank you, Judith, for going through all these things with me today.
You're welcome.
Actually, we do still use belladonna as for bladder spasms in the recovery room.
Fantastic. Yes. See, I'm always learning from the doctors.
So, yeah, there definitely some of these things carry over, but well, thank goodness a lot of them don't.
Yes. We'll talk about those too. Cocaine has been known for many centuries, and it's been used for, again, lots of things. As a pain remedy, not so much until Karl Kohler came along. His announcement in 1884 that you could use this to provide pain relief without knocking your patient out was a revelation to doctors around the world, and immediately they jumped on the bandwagon. Doctors started not only using it for local anesthesia, as Kohler had done, but actually going further afield, so to speak, and trying to numb larger parts of the body, which we know is regional anesthesia today. They also used cocaine for things like cough drops. They were in lots and lots of cough drops. Some of them combined with other things like menthol, which provided soothing, of course. And another of the tried and true remedies was morphine. It was isolated in about 1803, and those little blue bottles here would have been used if they didn't usually sell it in large quantities. Morphine continued in use for pain relief right into the Second World War, but it actually started being regulated along with other opioid drugs like heroin in 1906. So all of these would have been available for pain management of one depth or another before regional anesthesia really got its start. Around about 1890, oral analgesics came along in the form of things like aspirin and antifebrin, which is actually an anti-inflammatory agent. This is a Bayer product, largely aspirin with a few other ingredients. Bayer brought out the first aspirin product and named it aspirin. It's based on actually willow leaf, willow bark, which has anti-inflammatory properties. And a lot of our drugs are originated as botanicals, like cocaine.
Right.
Oral analgesics, though, really got their start in the 1890s with things like antifebrin. And analgesic agents are often mixed with anti-inflammatories because so much pain comes from, particularly joint pain, it comes from swelling.
Right, right. And so does this predate aspirin?
No, it's a few years later.
Okay, all right. So it's an aspirin-like substance,
it has
but with
aspirin
other
in it,
okay,
along with other ingredients.
and it would be given orally.
Yes.
Okay. Well, and that's becomes such an important, the multimodal analgesia that is such a popular and important thing right now that we've. So it's interesting to see what carries through over the course of time. I guess the things that work.
Yeah. Yeah, we hope. We're coming up to the turn of the century now in terms of time. In 1904, Dr. Yankauer invented his face mask for inhalation anesthesia. It combined a dome of mesh to hold the cloth and a rim that would have held the drops of liquid ether or liquid chloroform that would have fallen off the mask, because both are very irritating to the skin, as you may know.
So Judith, when I look at these masks and hear you talk about all that went into this and the drops and everybody breathing this, it becomes immediately clear why regional became so important. And the focus then turned to using those techniques instead of using techniques like this. And especially, I'm assuming that this cloth would have to be replaced.
Oh, yes. That's exactly how it would be used. They would put some kind of cloth cover over it, and this is held in place by a tight spring. And from one anesthetic to the next, from one surgery to the next, you hope that they would change the gauze. They didn't always, we're pretty sure of that.
Yeah.
But that would have been the sanitary way to handle it, right?
And then, the other thing, now we combine regional with sedation. Mm-hmm. But back back in those days, that would have been very difficult to do. There just really wasn't a good sedation. It was either a general anesthetic or not.
Sedation really didn't come into its own until curare, actually, which is not part of our story. But that type of agent where you could keep the patient still allowed a lighter level of inhalation anesthetic so that they weren't squirming around.
Well, yeah, a muscle relaxant will make you not squirm.
That really was a major change in what they could do.
Sure.
And as you said, until then, the only way to keep the patient deep enough sometimes was to overdose.
Sure, yeah, right. And without monitors, it was very difficult to walk that line, I'm assuming, which is why safety was, why a lot of people died during surgery.
Unfortunately, there was that.
Yeah.
Another very widely used topical analgesic was ethyl chloride. It had actually been proposed in the 1840s as an inhalation agent, but it acted so quickly that they couldn't find a way to control it, and you'd open your bottle and it would be gone. Until Dr. Jules Bengay invented the spray nozzle. Well, this is a typical ethyl chloride bottle, and there were many manufacturers, and the bottles are usually like this, using Bengay's spray nozzle. You want to try it?
Yeah.
Don't be afraid.
I am.
You can see that the lever doesn't go down very far.
No.
That's because it only opens a tiny bit to let the spray out, which of course is a kind of refrigerant because it evaporates so quickly on the skin.
We still use things like that today for starting IVs and to kind of essentially freeze the skin. So it's fascinating that it has carried over all these years. And obviously a different format. We don't use a lot of glass.
Well, ethyl chloride is probably one of the oldest anesthetics still in use.
Yeah.
It was first recommended for inhalation anesthesia in the 1840s.
Wow.
And Bengay is still around making this, usually in cream form. And that leads us to an invention that came out just a few years after the spray nozzle, and that's procaine. Procaine hydrochloride, better known to most people as Novocaine, was synthesized in 1905. Novocaine usually came in crystal form, as did many other drugs, particularly those that followed. It was also available in tablet form, as we saw in that bottle. You had to melt it in order to be able to inject it. So it would have been placed in this cup, and if you can see the graduation lines that told the person making the mix, how much they were using, they would know how much was needed for what they wanted to do. Then it would have been held over an open flame, maybe a Bunsen burner, and melted. After it was melted, then it would be added to sterile water for the injection. Usually that was done by a nurse, that mixing.
There's several things about that when you think about current practice, an open flame in the operating room is something that, we try to avoid. And so thinking back to all of these hazards and, not only was it an open flame, but we talked about, the medications like this that they were probably using in the same operating room that are so incredibly flammable. You can see where going to work could have potentially been quite hazardous.
It could, yes.
If you didn't burn your fingers, you might start the whole place on fire.
That's the thing that always fascinates me about these wire holders, is that they were not insulated.
Yeah.
So I can imagine what it must have been like to hold that over flame while you're holding this metal rod.
Right.
Henbane has been used for centuries to make people sleep, usually because of a pain situation. It began to be synthesized around the turn of the century and was used primarily as a sedative, not usually combined with other ingredients, but sometimes it might have been combined with cocaine or something else. People were experimenting. Lots of other analgesic agents came along at the same time.
So how was this given? It was a liquid that was given orally or injected?
In the beginning, it was definitely an oral administration,
Okay.
but later on, the drug scopolamine was derived from it, and that's the blue box in front of you. Scopolamine was definitely made for injection, and it was used, I think, primarily for surgical sedation.
Okay. Yeah, so we use scopolamine a lot now in a patch form as an antiemetic. So it's interesting to me to think about how it would have been used as an injectable.
Mm-hmm. It has many different uses, many different effects on the body. It's what one of my colleagues calls a freaky deaky agent.
Yes, definitely.
One of the things it's been used for is as a truth drug. That was in World War II. There are varying accounts of whether it was actually useful, but it was used for that because it does limber a person up and make them a little more chatty. Other types of analgesics were also oral, as hyoscine was in the beginning. Anticamnia is a good one. I know you were interested in this particular agent because of all it claimed to do.
Yes.
This was marketed primarily for headaches. But if you want to read the back.
The indications are very interesting. For headaches, neuralgias, rheumatic and sciatic pains, colds, la grippe, and women's pains, etc. I find that really interesting. For one, I had no idea what la grippe was.
I understand it to have been a very bad cold.
So, and this would have come in a powder, because it says
powdered form and tablet form.
10 grains.
Yeah.
So
yeah, we did have to get rid of the contents. It was a yellow powder.
Okay.
I wanted to mention also, this was the subject of a lawsuit because of all the things they claimed it would cure, and didn't quite do that. Another oral analgesic was Anacin. Anacin as a drug was still in use, although it's a very different formula than it used to be. It contained acetanilide and a few other things. And it was not marketed to be something it wasn't. It was basically a headache remedy or a pain remedy. One thing that we find interesting about this particular brand is that it was originated by the Heidbrink Company, which also made anesthesia machines.
Yeah, I was just going to say the anesthesia machine company.
Yes.
So would this have been a tablet then?
Yes.
In tablet form?
Yeah. And there was some regulation of some of the ingredients, and as a result, the formula was changed. And about the same time, the company changed hands to the company that owns it now. Another important local agent, and particularly for topical, but also for injection, was benzocaine. And this is a particular formula for injection that would, again, have been for a small area rather than a large area of the body.
Right. Would that have been used for dental work maybe as well?
Yes, definitely for dental. And probably this type of packaging would be tablet form.
Oh.
It's in a blue bottle because blue was the color of glass used to contain poisonous drugs or drugs that were considered dangerous.
I was wondering, this one says poisonous right on the label, and it's a nice dark color too.
The color is another clue that that's not something to be used lightly. And also, you just grabbed it, you can feel the ridges on the glass. That's also, if you reach for that bottle in the dark, and you feel that kind of texture on the glass, you know it's not something you should be taking in the dark because you want to know what's in it. This also has that texture on the, although instead of ridges, this is like diamonds, diamond shapes cut into the glass. Another local and regional anesthetic that came along around the turn of the century was Stovaine. It was concocted by a Dr. Fournier, and in French that means stove, so he called it Stovaine. He wanted to call it Fernocaine, but that was certain people thought that sounded a little bit like a different word, starting with Forn. So it was considered perhaps not the most marketable name, and they changed it to Stovaine. This was specifically for spinal anesthetic, and it contains all these glass ampules. This is the typical packaging for liquid agents, particularly injectables, and each of these ampules would have been opened with a razor blade.
Oh, not just a snap open like...
They snapped it they scored it with a razor blade and then snapped it. Yeah.
I suppose ours now come pre-scored.
Yeah.
And when would this have been used?
It was introduced in 1904, and it had a vogue through the teens and into the 20s, but other agents came along that replaced it.
And was it known to be a long-acting agent?
I believe it was supposed to be. Yeah. Okay. The shorter-acting agents came along somewhat later in the 30s by demand, basically. The population of practitioners said, we want something that's going to allow a quicker emergence.
Okay.
In 1915, Dr. Cannell invented his artificial airway. It wasn't the first, but it was the first to have this idealized S shape that almost everybody copied after that.
Sure.
He cleverly had an opening at the top and on each side to allow airflow. It's very narrow, though, and many of the early airways were.
Very narrow.
And as you see, there's really no protection against breaking the teeth when someone bites down on that. And most of the metal airways had no protection until we come to the 1930s again.
Yeah, I'm curious. I can understand the openings on the sides, but this opening on the top is a little bit peculiar to me because you would think that the tissue would be lying against the top anyway. So
in case of one or another of the openings being occluded, it was just extra protection.
Very interesting.
This syringe, called the carpool syringe, was introduced in the teens also. And it was introduced by a particular company that made the carpools, as they were called. They're an ampule that was meant to be pierced by the handle of the syringe to do the job, and it would have had a needle at the end.
When I was an early resident, we had one of our pain medicines came in what we called a carpiject kind of thing, but it sounds similar.
Yes.
So I'm guessing it's the
same. The name may come from this.
Yeah,
yes.
probably. And so you would screw in the thing, and then you could inject. We didn't have a needle at the end because you would hook up to a stopcock on a IV. But prior to the days of stopcocks, I'm assuming they would have injected right in. So
this is a mask that would have been used hooked up to an anesthesia machine. It wouldn't have been like those Yankauer masks we saw earlier, where you just slap that on the patient and pour on the liquid and they breathe it in. This would have been hooked up to a hose that led to the anesthesia machine to administer the gas and also air. It dates from the teens, and this was also made by the Heidbrink company for their equipment, which was introduced in about 1910 and was in vogue for decades. Many anesthesia machines also used a see-through mask like this, because if someone's going to barf, you want to know that that's what's happening under the mask.
Right. Yeah.
This also has a
a
valve to increase or decrease the amount of fresh air coming in.
Okay.
You play with it.
Yeah, I was wondering if it also increased or decreased it would essentially the back pressure, or the kind of PEEP that's applied, but.
That's something I hadn't thought of. As a matter of fact, Heidbrink did invent a pressure valve, but I think that may have been a precursor to it.
Okay. Yeah, very interesting. That would be very uncomfortable on somebody's face.
Some of the masks had a rubber rim,
that would make more
but I've
sense.
never seen a rubber rim on a celluloid mask.
Okay.
The shape is intended to make a pretty close fit around the mouth, but nothing's perfect.
Yeah.
Well, that about wraps up what I wanted to show you from the period before 1920. The next grouping that we'll look at are from the 20s and 30s.
Excellent.